How is Pel-Ebstein fever linked to lymphoma? Pel-Ebstein fever is an interesting and rare fever pattern that can be linked to lymphoma, particularly Hodgkin's lymphoma. This fever is characterized by recurring episodes of high fever that last for about 1 to 2 weeks, followed by periods without fever that are of similar length. While this cyclic fever is most commonly associated with Hodgkin's lymphoma, some patients with non-Hodgkin lymphoma may also experience fevers, although the classic cyclic pattern is less common in those cases. The exact reason for Pel-Ebstein fever is not fully understood. It is thought to be connected to the immune response triggered by the lymphoma itself. When lymphoma cells or immune cells, like macrophages, are present, they can release substances known as pyrogenic cytokines. These include interleukin-1, interleukin-6, and tumor necrosis factor alpha. These cytokines can influence the hypothalamus, the part of the brain that regulates body temperature, causing it to raise the body's temperature set point and resulting in fever. The cyclical nature of Pel-Ebstein fever might be due to fluctuations in the releases of these cytokines or changes in tumor activity. However, this remains a topic of ongoing research and debate among scientists and medical professionals. In clinical practice, the presence of Pel-Ebstein fever can be a helpful clue in diagnosing Hodgkin's lymphoma, especially when other infectious causes of fever have been ruled out. It is important to note that while this fever pattern is a distinctive symptom, it is not universally present in all patients with Hodgkin's lymphoma. When it comes to treating Pel-Ebstein fever, the focus is primarily on addressing the underlying lymphoma. This is typically done through chemotherapy, which often resolves the fever cycles. In some cases, doctors may also recommend anti-inflammatory medications to help manage fever symptoms during episodes. In summary, Pel-Ebstein fever is a rare, cyclical fever pattern that is primarily linked to Hodgkin's lymphoma. It is thought to result from the releases of fever-inducing cytokines by lymphoma cells or the immune system. Understanding this connection can assist healthcare professionals in diagnosing and managing this type of lymphoma. If you have concerns about fever or lymphoma, it is always best to consult with a healthcare professional for personalized advice and treatment options.